Hello, I'm Dr. Dean Elterman from the University of Toronto, and it's my pleasure to present avoiding further BPH treatments is the most important attribute to men with BPH. These are my disclosures. So let's begin with a bit of background. We know that BPH is a highly prevalent condition affecting up to 70% of 70-year-old men. We also know there is a significant economic burden with up to $3.9 billion spent every year in the United States. BPH surgical management has certainly evolved over time. More traditional surgeries such as transurethral resection of the prostate are perceived to be more invasive as they're performed in an operating room with an overnight stay, typically with a longer recovery period. There are now a number of newer, minimally invasive options available for the treatment of BPH. And really the decision-making comes down to patient preference. And there are a number of attributes with each of these profiles, such as setting of care, duration of the procedure, potential side effects, and need for retreatment, which will all influence how patients choose which modality they treat their prostate with. The newest, or one of the newest technologies is water vapor thermal therapy, WVTT, or Rezūm, water vapor therapy for the prostate. This has been shown to be very safe and effective as a minimally invasive surgical treatment. And one of the advantages is that it can be performed in an office as well as an outpatient setting. The objective of the study was to identify the most important attributes of BPH surgical procedures for Canadian men with moderate to severe BPH undergoing convective water vapor thermal therapy. This was an online survey of Canadian men with lower urinary tract symptoms due to BPH who all underwent Rezūm or water vapor therapy between April 2019 and November 2020 at an academic Toronto urologic clinic. The survey was distributed to 170 patients, and this study was approved by the University of Toronto Ethics Committee. In terms of study design, the survey was developed through a literature review looking at various attributes within BPH therapy, as well as those specific to Rezūm, and it was validated by a clinical expert. Survey questions analyzed patient demographics, 8 attributes for selecting BPH procedures, and 5 attributes specific for Rezūm or water vapor therapy. Patients were asked to rank the importance of each attribute on a scale of 1, not important, all the way up to 5, extremely important. So in terms of the patient perception questions, these were the 8 attributes for BPH procedures. The procedures performed in a non-hospital setting, procedure length of time, how long it takes to return to normal activity after the procedure, 4, whether catheterization after the procedure is required, 5, wait times to receive the procedure, 6, the procedure is performed under sedation or local anesthesia without the need for general anesthesia. 7, the need for following BPH treatment for recurring BPH symptoms, in other words, treatment durability. And lastly, the cost of the procedure to the patient. And there were 5 attributes associated with water vapor thermal therapy. 1, preservation of sexual function. 2, avoiding daily BPH medications. 3, avoiding more invasive surgical treatments. 4, avoiding long wait times to receive other surgical treatments for BPH in the public system. And lastly, 5, a quick recovery and return to normal activities. So we had a very good 75% response rate of 128 out of 170 patients. These were men who were largely between 60 to 69 years of old. They were generally Caucasian and married. Most of them were retired, and there was a fairly even distribution of income. So looking at the results for ranking of BPH in terms of the 3 most important attributes, we found that number 1, the ability to avoid further BPH treatment was at the top, followed by duration to return to normal activities, and number 3 would have been wait time for a procedure. What was also interesting is that duration of catheterization was only seen to be very important or extremely important in 47% of men. So when you put together very important and mostly important, 98% of men rated avoiding more invasive surgical treatments as very important or extremely important attribute of water vapor thermal therapy. and 88% ranked a quick recovery as a very important or extremely important attribute. So in conclusion, the most important attributes for choosing BPH procedures were avoiding further BPH treatments in the future, quickly returning to normal activity, and wait times to receive the procedure. Most men chose water vapor thermal therapy to avoid more invasive procedures and to have a quick recovery. I'd like to thank the ICS very much for this opportunity.